Welcome to the part 2 of how to make effective point combination. In this video, we will continue from the video 1 where we ended. When treating effect and cause, there will be a condition where there will be chronic interior plus acute exterior problem. For example, a chronic interior condition of deficient Qi with tiredness may allow periodic exterior invasion by wind cold with influenza. During the acute phase, the influenza effect is treated by expelling the wind cold. During the chronic phase, the cause is treated by tonifying the Qi. When treating effect and cause, there might be another condition where chronic interior will be accompanied by acute interior. For example, deficiency of spleen Qi may result in the spleen not holding the blood with severe bleeding. The acute effect must be treated first, for example, with points such as SP1 and SP10. Once the bleeding has stopped, the deficiency of Qi that caused it and the deficiency of blood resulting from it can be treated with points such as UB17, UB20 and UB43. Now comes the last one, treating cause and effect both at the same time. This is not used for external problems since the external factor must be expelled first. It is, however, the commonest method of treating interior problems. For example, a headache associated with liver yang may have an underlying cause of deficient kidney Qi. CV4 and kidney 3 for the deficient kidney can be used simultaneously with GB34 and GB20 for the hyperactive liver yang.